There is nothing on my rubric. Knock, knock, knock. Hi there, my name is Meredith. I'm a nursing student at SVSU. I'm going to be performing a head-to-toe assessment on you. Is that okay?
Yep.
Okay. Can you just tell me your name and birthday?
Genevieve Cook, April 3rd, 2008.
Okay. Can you tell me what year it is?
2025.
And then can you tell me what city you're in?
Freeland, Michigan.
Okay. My patient is ANO times 3, so I feel good to continue the assessment. I'm just going to first start by asking you a couple of questions. Do you have any pertinent medical history that I should know about?
No.
Any allergies?
No.
Any past or present medical diagnosis?
No.
Any family history?
No.
Surgical history?
No.
Do you take any medications?
Birth control.
And do you see an OBGYN?
Yeah.
Any issues with it?
No.
No? Okay. Any herbs, supplements, vitamins that you take?
No.
Okay. Do you smoke, drink, vape,
No.
do drugs?
No.
Okay. How does your diet look?
My all 3 meals, protein, veggie, fruit, dairy.
Okay, good. How about your water intake? Do you think you should drink enough water?
Yeah.
Yeah. And then can you tell me a little bit about your exercise?
I work out like 3 times a week, moderate.
Okay, good. That's good. All right. That's all the questions that I have to ask you. So I'm going to move on to vitals before we start the actual assessment.
Okay.
Are you in any pain at all today?
No.
No. Left arm okay?
Yep.
All right. First, just doing a blood pressure. And I'm going to be using the diaphragm of my stethoscope to listen. (112/72). That's a good blood pressure and within the normal range. Now I'm just going to be listening to your pulse and then assessing for respirations. I'm going to do that for a full minute each.
Okay.
Alright. Also 72 respirations were 15, so those are all within the normal range. I don't have any concerns about those. Now I'm just going to be assessing for clubbing in your fingernails. Don't see any signs of clubbing, so I can assume that your oxygen is between 95 and 100. I'm just checking that because I don't have a pulse ox on me. Now I'm going to be assessing for temperature since I don't have a thermometer. Your color all looks good and feels good. So I can assume that your temperature is around 98.6. So that's good. That's everything for vitals. Now I'm going to move on to the actual head to toe assessment. I'm first going to be assessing your arms. First I'm just going to look. Don't see any lesions. A couple moles. Do you get those checked by the dermatologist?
Yeah.
Okay, perfect. See any signs of concern. Now I'm just going to feel. So for muscle symmetry and tone, it's even throughout, and temperature. It's also even throughout. Now I'm going to be assessing for capillary refill, and that's going to be perfusion. And those are all coming back in under 3 seconds, so I can assume that you have good cap refill. Now I'm just going to be feeling for your pulses. Okay. So first I'll do radial. You can just relax. Those are both symmetrical. And brachial. Those are both symmetrical. Now I'm going to be doing some range of motion exercises. So I'm going to have you roll your hands. Okay, good. I'm going to have you follow my movements. I'm going to start like this. Go up, down, back up. Perfect. I'm going to assess your strength. So I'll have you stay like this. Don't let me push in. Don't let me push out. Flip them. Don't let me push down. Don't let me push up. Pull my fingers. And then push me. Okay, perfect. Now I'm going to put my hands on your shoulders. I'm going to have you do a swimming motion. Okay, that feels good. Now go ahead, shrug your shoulders up. Don't let me push down. And then move your head side to side. That is testing cranial nerve 11, and that is intact. So that is good. That's your spinal accessory nerve.
Okay.
Okay. Now I'm going to be assessing your carotid artery. So first I'm going to feel for a pulse. Strong. Other side. Strong. Now I'm going to be listening for bruits. A bruit would be a whooshing sound, and it would be an indication of an aneurysm, which is a blockage. Okay. I'm going to listen to with the bell. Okay. Okay. Perfect. No signs of bruise there. Just going to look at your neck here. I'm looking for symmetry. I'm going to feel for symmetry of your trachea. Good. And then I'm just going to pull this down a little and test for tissue turgor. I see no signs of tenting, so I can assume that your hydration is good. Now I'm going to move on to your head. So first I will have you take your hair down for me. And I'm going to be inspecting your scalp. Do you have any issues with your scalp at all?
No.
No dandruff?
No.
Or psoriasis or anything?
No.
Okay. So you have highlights. Do you get your hair done often or just moderate?
Yeah.
Okay. Okay. And then I'm going to palpate your scalp. Tell me if you have any pain or tenderness.
No.
Okay. Don't see any issues on your scalp. I'll have you put your hair back up for me just for the remainder of the assessment, so it's a little bit easier. Okay. I am gonna feel for your lymph nodes right now. So I'm gonna start at the base of your skull, and this is gonna be your occipital, back of ears, post-auricular, pre-auricular, submandibular, submental. I'm gonna touch your neck, cervical chain. And I'm gonna have you roll your shoulders forward. That's gonna be your supraclavicular. And those both feel good. I don't see any issues with that. Now I'm just gonna go onto your face. So first I'm gonna assess for facial symmetry. Your eyebrows are even, eyes are even. I don't see any drooping, signs of lesions. Your lips are pink and moist, so I don't see any issues there. First I'm going to test for facial sensation, and that's going to be cranial nerve 5, and that is your trigeminal. So I'm going to have you close your eyes, and I am going to use a Q-tip to just poke on places on your face. Just have me tell me where it's at, and then what side it's on as well. Okay, so go ahead and close your eyes for me.
Left cheek, forehead, chin, right cheek, nose.
Okay, and I will have you clench your jaw for me. Okay, perfect. Cranial nerve 5 is intact. I am now going to move on to your nose. First, I'm going to assess your sinuses. So the frontal, let me know if you have any pain or tenderness.
Nope.
And then maxillary.
All good.
Okay. First, have you ever had like history of bloody noses? Have you broken your nose?
No.
Any history of infections in your nose?
No.
No. Okay. First, I'm gonna have you plug one nostril, breathe out, breathe in and out, and then other, breathe in and out. Perfect. To test your nose, I'm going to be testing cranial nerve 1, which is your olfactory. So I'm going to waft a scent in front of your nose, have you close your eyes, and you tell me what it is.
Okay.
Go ahead, close your eyes.
Cinnamon.
Okay. Cinnamon. Perfect. So cranial nerve 1, just a little chilly. Cranial nerve 1 is intact. Now I'm just going to look into your nose. So I'm going to give you a little piggy nose. Okay. Your mucous membranes are moist. No signs of a deviated septum, and no sign of polyps. So everything looks good there. Now I'm going to move on to your ears. I've been testing your cranial nerve 8, which is your vestibular condylar, or your acoustic, this whole time because you've been able to carry on a conversation with me. We're also going to test it later on with Romberg.
Okay.
Do you have any issues with your hearing?
No.
Oh, okay. I'm just going to pull your pen back and up and look inside. Looks good. Looking behind your ear, palpating. I see you have some piercings. Have you ever had any issues with those?
No.
Okay, other side, looks good, behind, don't see any issues. So ears are good. Now I'm going to be moving on to your eyes. So I'm going to be testing cranial nerves 3, 4, and 6, which is your oculomotor, your trochlear, and your appendix. So, do you wear contacts or glasses or anything?
Both.
Both. Do you have any issues with those? No? Okay. Any itchiness, dryness, redness?
No.
Okay, perfect. First, I'm going to be just looking at your eyes, having you look up and down, looking at your sclera and your conjunctiva. Do you have any sensitivities to light?
No.
No? Okay. I'm gonna pull down and have you look up. And other side. Now I'm gonna pull up and have you look down. Okay. Everything looks good there. Your sclera is white, your conjunctiva is pink, and I didn't see any drainage, so I don't have Any concerns with that?
Okay.
Now I'm going to be testing for Perla and those cranial nerves that I had listed earlier. Perla is to see if your pupils are equal, reactive to light, and accommodating. Okay, first I'm just going to shine this light, see if they react. Okay, and then constrict. And then constrict. Now I'm going to have you look at my nose, my pen light, and my nose, and my pen light, and my nose, pen light. Perfect. And now I'm going to have you follow the tip of my pen light, which is your eyes. This is the cardinal fields of gaze. Okay, perfect. I'm also going to test your cerebellar function right now. This is for coordination, and it goes with the cranial nerves as well. So I will have you put your legs down on the floor for me. First, I'm going to have you make an okay sign, and then tap each finger, and then as quickly as you can. Okay, that looks good. And then I'm going to have you put your hands on your lap, flip them back and forth. Perfect. And the last one, I'm going to have you touch your nose, and the tip of my pen light, your nose, tip of my pen light. Perfect. Those were all good, so I can assume that your cerebellar function is intact. Now I'm going to be moving on to your mouth. I'm just going to first start by having you open up, and I'm just going to take a look inside. I can see your tonsils, and your hard and soft palate. No cavities, teeth look good. Your basement membranes are pink and moist, so I don't have any issues. I'm going to be testing cranial nerves 9 and 10 right now. So I'm going to have you stick out your tongue and say ah. Okay, and your uvula rises on phonation, so I can assume that your cranial nerves 9 and 10, which is your vagus and your glossopharyngeal, are intact. Now I'm going to have you stick out your tongue and wiggle it side to side, and that's your hypoglossal, so I can assume that that is good, which is cranial nerve 12. Now Leslie, I'm going to do your facial, so I'm going to have you make a bunch of funny faces at me, and this is cranial nerve 7, so can you smile and frown and puff out your cheeks? Okay. I did cranial nerves 1, olfactory. We don't do 2 because that's with the Snellen chart. I did 3, 4, and 6. Your eyes. I did 7. I did 5. And I did 9, 10, 11, and 12. So those are all good. Now I'm going to look at my paper just to make sure everything is good, and then I'll have you turn around. Okay. Okay. Good. I'm gonna have you turn around. And then I will have you come around here first. Okay. First, I'm gonna be checking for your thyroid gland. I'm gonna be putting my hands around your neck. I'm not choking you, but I just wanted to make sure. Okay. But you know. All right. I'm gonna feel. And then I'll have you swallow. Okay. That is good. And then I'll have you come around. Now I'm moving on to respiratory. Do you have any problems with your breathing?
No.
No? Okay. Never had asthma or respiratory infections? Anything like that? No? Okay. Awesome. First I'm just going to be looking. Back looks good. Spine looks nice and aligned. You have a couple moles, which you said you get those checked, so I'm not worried about those. Okay. I see no causes for concern. Back here. I'm going to be listening to your lung sounds. I'm listening for resonance and using the diaphragm of my stethoscope. I'm going to be listening in 12 places and then also percussing afterwards. First, I'm going to be figuring out where the base of your lungs are at so that I know where to stop. So I'm going to have you breathe in. So I can assume that they are right here. And then can I have you push your shoulder blades back? Okay. So I'm going to follow this line while going down. Every time that I move my stethoscope is when you're going to take a deep breath. If you ever are feeling out of breath or short of breath, just raise your hand and we can stop, okay?
Okay.
Okay. We're halfway, you're doing okay?
Yep.
One more time with that one. Okay, those all sounded good. Lung sounds were clear, no signs of crackles or fluids in the lungs. And I heard resonance, that's good. Now I'm going to be percussing in the same 12 spots that I just did. Listening for resonance. Okay, those all sounded good. And I'm actually not going to tiebreak down because I'll have to pull it down. But respiratory is complete. Now I will have you lay down for me. Okay. Would you like to go under the blanket at all?
It's fine.
Fine. Okay. First, I'm going to be checking for JVD, jugular vein dysfunction or distension. Sorry. I'm gonna pull this pillow out. Gonna have, make sure you can see your neck good. I'm gonna have you turn to the side and relax your neck. Okay. And then other side and relax your neck. See no signs of JVD, so I have no concerns there. There's the pillow. If I did see signs of JVD, I would have her sit upright at least a 45 to 90 degree angle. Now we are going to be moving on to cardiac. So I'm going to pull this down. I'm going to be listening to the valves of your heart. First, I'm just going to inspect and look at everything. I don't see any signs of lesions. Your color looks good. No cyanosis. Nothing to be concerned of. Chest wall looks symmetrical. I'm going to put these down just to make it easier. This is going to be right. This is going to be left. First, I'm going to listen to your atrial valve. That's going to be on the right side. I'm going to listen first with the diaphragm and then with the valve. Clavicle, space, first rib, space, second rib, space. S1 and S2 sounds are present. Flipping to the bell. No signs of murmurs. Now we're going to move over to the left side. So I'm going to recount. Clavicle, space, first rib, space, second rib, space. Listening with the diaphragm first. And this is the pulmonic. S1 and S2 sounds are present. Gonna flip over to the bell. No signs of murmurs. So I'm in the second intercostal space. Third rib space. This is gonna be Erb's point. S1 and S2 sounds are present. Gonna flip over. First, listening with the bell. Redoing this one, sorry. I'm gonna recount, just to be safe. Clavicle, space, first rib, space, second rib, space, third rib, space. So this is Erb's point, starting with the diaphragm. S1 and S2 sounds are present. Flipping over to the bell. No signs of murmurs. So I'm in the third space, fourth rib, space. Fingers right here, near the sternal border. First, listening with the diaphragm. This is the tricuspid valve. S1 and S2 sounds are present. Flipping over to the bell. No signs of murmurs. So I'm in the fourth space. I'm gonna go down to the fifth rib, and then the space. I gotta recount. Okay. Space, clavicle, space. First rib, space. Second rib, space. Third rib, space. Fourth rib, space. Fifth rib, space. So this is the fifth rib space, and then I'm gonna go mid-clavicular down right there. This is gonna be the mitral. I'll listen with the diaphragm first. S1 and S2 sounds are present. I'm gonna flip back to the bell, because I just listened with the diaphragm. No signs of murmurs. Gonna flip back to the diaphragm, and I'm gonna listen to the apical pulse for 1 minute. Okay. Apical pulse was 76, which was close to your radial pulse from earlier, so I'm not concerned about that. So that concludes cardiac. Now I'm going to be moving on to abdomen. Do you want to go under the blanket?
Sure.
Yeah. Okay. And pull up your gown here. Knees back, left and right side. And pull your shorts down just a little. Okay. So first, I'm going to be looking from the side. I can see your aorta pulsating. And I'm going to move to the front. And I can see your aorta pulsating. I don't see any issues with that. No signs of lesions or abscesses or anything like that. So I feel everything looks good. I am going to be listening to your vowel sounds in the 4 quadrants, and then I'm listening for 3 to 5 gurgles in each, and then we'll percuss and palpate and listen to all your arteries.
Okay.
So first, make sure this is on the diaphragm. You're listening for 3 to 5 gurgles. 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 So that all sounded good. I forgot to ask, do you have any issues with your bowel?
No.
No? Have regular bowel movements?
Yeah.
Yeah. And then, what about, like, do you have any problems urinating? Any pain?
No.
Frequency?
Yeah, it's regular.
Regular? Okay, awesome. Now I'm just gonna be listening for your arteries. I'm gonna be using the bell of my stethoscope to do this. First, I'm gonna be listening for your abdominal aorta, so I'm gonna go at the xiphoid process and your umbilicus and meet in the middle. Listening for bruits here. No signs of bruits. Now I'm going to be listening to your right hepatic. No signs of bruits. Left hepatic. No signs of bruits. Now I'm going to be moving down to your iliac. No signs of bruits. And this is your left iliac. I just did the right iliac. Okay, no signs of bruits. Those all sounded good. Now I'm just going to percuss your abdomen. I'm going to be doing in all 4 quadrants, and then I'm going to try to find your liver as well, the liver border. So this shouldn't cause you any pain, it's just going to be some light tapping. And I'm listening for tympani. Okay, those all sounded good. Now I'm going to try to find your liver border. I'm listening for a dull sound. Okay, the liver border is right about there. Listen for dull. So that is all good. Now I'm going to be doing some light palpitation. This shouldn't cause you any pain, but let me know if you are in pain. It just might be a little uncomfortable.
Okay.
And now some deep palpitation. Any pain?
No.
Okay, perfect. That concludes our abdomen. So now we can move on to your legs. Put you down. All right, just gonna move the blanket. Okay. Move your phone over here, sorry. Okay. First, I'm just inspecting your legs. Everything looks good. See a couple scars, couple moles, but nothing to be concerned about. I'm gonna assess for edema. We'll just do some poking. No signs of edema. And I'm just gonna feel for muscle tone and symmetry. Those feel good. And temperature as well, even throughout. I'm just gonna take your socks off, okay, so I can inspect your feet and your tap refill. Feet look good. In between your toes, bottom of your feet. Okay, I'm gonna assess for tap refill. Those are all coming back in under 3 seconds, so I can assume that you have good perfusion. Now I'm going to be assessing your pulses, and then I'll do a sharp mental test as well. First I'll do your the ones down here, and then I'll go back up to your femoral.
Okay.
This is going to be your popliteal under the knees, and Those are strong and symmetrical. Posterior, yeah, tibialis. It's gonna be right here. Those are strong and symmetrical. And then your dorsalis pedis, which is gonna be right up here. And those are also strong and symmetrical. Good. Now I'm gonna be coming back up for your femoral. I do have to reach my hands down your pants. Is that okay?
Mm-hmm.
Okay. First, I'm going to feel for it, and then I will listen for signs of bruise using the bell of my stethoscope.
Okay.
My fingers are right here, and I can feel her pulse. And then I'm just reaching down the other side. Fingers are right here. Awkward angle, sorry, but they are equal and strong. Now I'm going to keep my finger here and listen for signs of bruise. No signs of bruise there. Okay, I'm going to look at my paper one more time before I get you up, and I'm done. We're gonna do the sharp and dull test before we get up. I'll be laid back down for this. I'm gonna have you close your eyes. Have you ever done a sharp and dull test before?
Yeah.
Okay, so this is gonna be sharp.
Okay.
And this is gonna be dull.
Okay.
I'm just gonna go at 8 spots and just tell me what part of the body it's on and on what side as well.
Okay.
Close your eyes for me.
Sharp left thigh. Dull left foot. Dull left shin. Sharp right knee. Dull left shin. Right. Dull right foot. Sharp right thigh. Sharp left knee. Dull left foot. Sharp right foot.
Okay. All right, you only got one wrong, so I can assume that you don't have any peripheral neuropathy and that it is okay to get you up. That one's always this test is kind of hard. Put your socks back on. All right.
Did I get that foot wrong?
Yeah.
I knew it.
All right, I'm gonna have you sit up to the edge of the bed. First, we're just gonna be doing some range of motion. We'll reach back and tie your gown here before we get you up. This one too. Okay. First, we're gonna be doing some range of motion and strength exercises. So can I have you roll your ankles in a circle? Perfect. Now separate your knees a little. Whoa, I almost just fell. Okay. Can you don't let me push out. Don't let me push in. Don't let me pull. Don't let me push. With your ankles, don't let me push in. Don't let me push out. Good. All right. Also going to assess for edema right here. No signs of edema. Sorry. Now I'm going to be doing your reflexes. So maybe scooch over just a little, just so I can be on the side. Okay. Find your tendon. Perfect.
Good.
Yeah. And going to this side. Finding your tendon. Okay. Perfect. Those are good. So we're testing for your strength, your range of motion. And I did cerebellar function earlier. So now I feel good to get you up and get your shoes on, we are going to be doing a Romberg test once we get you up before we get you walking. And that's going to be testing cranial nerve 8. I can't. Not good at getting shoes on apparently. Okay. Alright, and I'll have you stand up for me. I'm going to have you close your eyes, hands to your side, feet a little bit apart, and I'm going to have you close your eyes for 30 seconds. I'm testing for swaying. Okay, no swaying, so that as a negative Romberg, and I feel good to walk you. First, we're just gonna walk a couple steps, and then we'll turn around and we'll go heel to toe, and I'll be assessing your gait.
Okay.
Alright, so let's just walk. Perfect. Turn around, and then heel to toe for me. And you can just walk to where you were seated on the bed. Okay, that looks pretty good. Now I'm just gonna give you a Braden scale. I am gonna score you a 23 on the Braden scale because you're not incontinent, you have good mobility, good nutrition and hydration, no friction and shear. So yeah, alright.